Hello, my name is Shanti Mehta, and I'm a second-year medical student at the University of Toronto. I was fortunate to receive the Canadian Association of Psoriasis Patients grant in 2024 with Dr. Leahy Etter. We know that patients with psoriatic arthritis, or PSA, have a higher prevalence of diabetes compared to the general population, and that PSA disease activity has been found to be associated with a higher risk of developing diabetes. The bidirectional relationship between glucose intolerance and PSA disease activity and duration remain unclear. The aim of this retrospective cohort study was to investigate the association between glucose intolerance and disease activity. Our study followed nearly 280 patients with PSA over 8 years, totaling to over 1,000 visits. We tracked variables including PSA activity and blood sugar levels through a test called HbA1c. None of the patients in our study had diabetes. We found that a longer PSA duration, especially beyond 5 years, was linked to a more rapid decline in glucose tolerance, even after accounting for factors like age, sex, and body weights. This means that the longer someone has PSA, the higher their risk is of progressing towards diabetes. However, we didn't find a direct connection between PSA disease activity and glucose intolerance as measured through HbA1c. The takeaway is that there seems to be a window of opportunity early after PSA diagnosis to focus on prevention. By addressing risk factors like weight and monitoring of blood sugars closely, we may be able to reduce the chances of developing diabetes. These findings underline the importance of regular checkups and proactive care for PSA patients. I would like to thank all members of Dr. Etter's research team, as well as the Canadian Association of Psoriasis Patients, for their support.